Good morning. Thank you, Dr. McIntyre, and thank you for being here in this kind of not easy day or not sunny day. Thank you for the presentation, and in the next couple of minutes, I will explain, I will do the follow-up of this big project, which named HARMONY. And HARMONY is a different project, it's a totally new project. Now we are in the third year of the project. We are collecting an important amount of data set to be managed as a big data to improve the diagnosis and the treatment of the hematological malignancy patients. I want to let you know that this is one of the first big data projects in Europe, and maybe it's the much more big project in the big data area. And which are many different characteristics of this new program, of this new idea coming to the hematological arena, is that this is the large public-private partnership for big data in hematology, but also in the other health specialties. We are inside the IMI project, inside the H2020 project, and the main aim is to use the big data, artificial intelligence, machine learning to enable better and faster treatment for patients with hematological malignancies. This is quite a big project with 53 members, composed by 45 public institutions, and in addition, 8 pharma companies. But one of the main, let's say, characteristics, of the silent characteristic of the project is the fact that we join all the stakeholders on the field: patient organizations, regulatory agencies, HTAs, institutions, as European Hematology Association, and I'm really very happy, and I want to thank the European Hematology Association for providing us this possibility to share with you this project, but also all the hospitals involved on the field, biotech companies, and as I told you, regulatory agencies. In addition to this large project, we also have a large number of European institutions, hospitals, working cooperative groups, all the actors involved in the field of treatment of patients all over Europe. All over Europe, and in fact we have already signed contracts and compromise with these data providers and committed about 20,000 patients, 20,000 data sets coming from patients. In HARMONY, we are covering almost all hematological malignancies. We are mainly, we have focused in 7 pillars of diseases, and there are many projects inside this program. There are 3 pilot projects regarding acute myeloblastic leukemia, in which we are planning to study, or we are studying now, the identification of the gene-gene interactions and the impact in disease outcome. We also have collected some cases, about 5,000 cases of CLL, trying to perform a large-scale mutation analysis to establish a novel prognostic and predictive scheme for improved risk stratification of the patients. In MDS, we will look for the role of the hypomethylating agents in MDS. And also we are planning, or we are doing now, and we are collecting over 5,000 cases by the European Myeloma Network to perform a revised international staging system of myeloma patients. There are also projects in acute promyelocytic leukemia, acute lymphoblastic leukemia, and T-cell non-Hodgkin lymphomas. Well, these are the achievements that we have we had in these last 3 years. We have established a huge European network to share data in blood cancers with the ethically approved and legally compliant with the GDPR. We have built up a clinical big data platform, including data series from patients with hematological malignancies. And this is important also to stress that we have data coming from the industry and from the public side, together inside the big data platform. This will allow, and this is the first time in which we will manage clinical data, high quality clinical data, together with the omic data, in order to speed up the drug development and to get much more access to the bedside process in the drugs, and also in order to establish new biomarkers to be much more active for the therapies in these hematological malignancies. These are the words. We will have a meeting today, 2:45 in the hall E106. You are invited to join to know better which are the last minute of the different projects. And for those who want to take some information, there are information for the Harmony project at the table there. Please use this info to be much more updated about the Harmony project. Thank you very much.
Thank you very much, Jesus. This presentation is now open for questions. If you could just give us your name when you ask a question and the journal that you represent or the paper that you represent.
I'm Cristina Ferrario for Cancer World. Are you planning to extend the project also to the Eastern Europe? Because I've seen that there's no Eastern Europe countries inside the project at the moment.
Yes, we are now in the first phase of the project. Now we are just in the middle of the project. We were mainly focused in those high quality data coming from already published papers. It is a reuse of data just to feed the data platform and just to see how the data platform is working. Our idea is to go to the East countries, and in fact we are starting to sign the contracts with the countries in the East. We have already signed some contract in Poland, Czech Republic. Czech Republic is a partner of Harmony, so in some way we start to have some history. But also we are in the preliminary talks to expand or to have contacts with the ASH in the States and also with the Australian Association for Hematology. And we have some meetings with the Australian Association because they want to copy this in some way to perform this kind of idea, to develop this kind of idea there.